At Sentara, we have a comprehensive neurosurgical department. We cover all major areas of neurosurgery: brain tumors, functional neurosurgery, peripheral nerve surgery, tumors, standard degenerative spinal disease, vascular malformations, aneurysms, AVMs. We have fellowship-trained experts to help guide the treatment of these disorders. At Sentara Norfolk General Hospital, we have a wide range of technology which allows us to provide the most up-to-date care possible, state-of-the-art care for the patients that come to us. For brain tumors, we have the ability to do mapping with functional MRI, diffusion tensor-weighted imaging to map the tracks of the patient's language centers, visual centers, and motor centers, and protect those areas and actually physically see on the imaging where the tumor is and where those tracks are and how they are displaced in ways that maximize the chance that you're going to resect the entire tumor but minimize patient side effect afterwards. We also have complex deformity planning software for complex spinal problems, up-to-date spinal navigation systems for ease of placing instrumentation in the operating room, and we have the most comprehensive neurosurgical department in the Hampton Roads area. We continue to stay up to date on current technologies, and we always have surgeons investigating new technology in their field. When a patient comes to me or any of my partners for a problem, they can expect that that problem will be evaluated, that we will give you an honest opinion about what your options are, whether or not surgery is right for you. But it goes beyond that. Once the operation is done, we'll make sure that you heal appropriately and that we've achieved the goals that we want. The thing about back pain is, most back pain, the chronic back pain that we have in our daily lives, doesn't need to come to the attention of a surgeon. But when back pain is severe, affects daily quality of life, hasn't responded to the normal things that we might do, the rest, ice, take a break, or if that pain is severe and radiating down a leg, or if you have weakness in one of your legs, that's a sign that there's something very wrong in your back. In the world of spine surgery, there's standard degeneration, arthritis, arthritic pain, neural compression causing radiating nerve pain. But then there's more complex problems. A deformity could be a result of an adolescent scoliosis that didn't require correction in childhood, but as they aged, the curve progressed, or the curve itself accelerated degenerative changes and creates a complex problem that requires a certain amount of experience and expertise to address correctly. The most common thing is standard degenerative problems, and those standard degenerative problems are very often herniated disc pushing on a nerve root in the neck or low back, which can be very painful and very responsive to treatment. Lumbar spinal stenosis, which causes a constriction of the nerve roots in the low back, so that when the patient sits or leans forward, they feel okay, but when they stand and try to walk, they get building pain in their buttocks and legs that makes it difficult to walk for any length of time. And the last thing is cervical spondylitic myelopathy. The aging spine in the neck sometimes isn't even painful, but as the spine develops wear and tear, and the joints hypertrophy and the discs age and the bones slip out of place, the spinal cord can become compressed. And for many patients, that's not even painful. That can be a subtle finding. I don't have the same balance I used to. My hands don't have the same grip strength they used to. I guess this is part of aging, but it's not. So those three entities make up a lot of the people who walk through the door. Painful disc herniations, severe constriction of the nerves in the low back, lumbar stenosis, and cervical degenerative disease causing either painful radiculopathy down the arm or an insidious onset of subtle symptoms, which are the harbinger of disability to come. The last two conditions require surgery for treatment. Severe spinal stenosis requires a surgical decompression for any sustained relief. The constriction of the spinal cord in the neck, it is paramount that we identify that and stabilize and decompress those levels as soon as possible. As far as a herniated disc, most of those respond to non-surgical methods. The reasons to operate on those are if you have severe pain that really cannot tolerate physical therapy and some rounds of steroid injections, or significant weakness. If that nerve is so compressed that your muscle group is not working, that nerve goes to, if your foot does not go up and down, that's a disc which probably requires surgical intervention as first-line therapy. Many patients who come see me don't get surgery or never get surgery, don't need surgery. Many patients just need to get evaluated, told that they don't need surgery, and then set up with the proper care so that they can feel better and get back to the quality of life that they're looking for. Other patients do need surgery. And if you come to the office with a problem that's going to require surgery to fix that, I'll tell you that. And I'll explain why you need surgery, why this isn't going to get better without surgery, and I'll explain in detail what the surgery is, what the alternatives are, and ultimately it will be your choice whether or not to have that surgery. Every patient's spinal problem is different, and so every patient needs a unique solution. And that's what we do here at Sentara, is approach these problems from a global perspective to try and find the right answer for the